Hey, Dr. Rob here, Facebook Live. We've got a great talk today. Looking forward to sharing a whole bunch of things with you. Today we're going to talk about treatment for lower back pain, and I'm going to share some ideas on how to do it without drugs or surgery. This is all based on the Lancet 3 papers that came out in March of 2018. These were breakthrough papers. So everybody, do me a favor. Comment. Ask a question. Let's get a beautiful string of comments and questions. You want to say hello? I'll stop everything. I'll say hi to you. In addition, like, click, and share this. 8 out of 10 Americans have lower back pain, and this is a vital conversation. And for my chiropractors who are watching now, if we just stuck with this, we would be so busy and help so many people. I had 3 new patients this morning, all walk in with lower back pain, and I had used all the treatments that we're going to talk about and all the treatments that the Lancet had agreed would really be breakthrough in getting the clinical outcomes that are needed for lower back pain. So big shout out if you guys are in New York City tonight. Don't forget, tonight at 6:30 I'm at Boulay, and we virtually have a sold out show. We're at Boulay tonight down in Tribeca starting at 6:30, talking about feed your gut, feed your brain. And that actually does pertain to some lower back issues. So let's go in and let's see what the Lancet had talked about. Number 1, they said people are not exercising enough. They're not doing their core strengthening. You'll see in my treatments that exercise will decrease lower back pain, proper exercise, by 50%. And we'll talk about how to do the core, and we'll talk about some of the big things like bracing to help the core. In addition, they now found that pain is a protective mechanism. It's protecting you from moving into damaged structures. It's not a measure of tissue damage. So everybody says, ow, it hurts. It's not measuring how much tissue damage you have. It's a mechanism not to damage the tissues. Very interesting. So people take what we call anatalgia. They move. They take a different position. You're taking that position not to damage the tissue. It's your body's response to injury to allow you to protect your structures. One of the patients came in today. Interesting. Her biggest problem was she wasn't walking right. She said, listen, I'm not in that much pain, but she used to be in a lot of pain. So what happened was she retrained her brain to accept a new movement pattern because of this protective mechanism, which we'll get to in the treatment. So just understand, new view, pain is a protective mechanism, not a measure of tissue damage. In addition, the evidence is extraordinarily weak on spinal surgery. I have a lot of friends that are orthopedics. We refer patients back and forth. They know it. That doesn't mean that spinal surgery is a no-go. It just means it is not a prophylactic type of treatment just because you have lower back pain. The studies are out there, and they've just been added, and we realize that lower spinal back surgery is not effective as a general rule. Search conservative treatments instead of running in and get that fusion, discectomy, and things of that nature. In addition, scans, MRIs. MRIs, they're vital for us to use, but I don't treat MRIs. I do take them. I do prescribe for them. But I treat patients. MRIs are an indicator towards something. But what they found in the Lancet was the MRI and the damage on the MRI wasn't necessarily indicative of what is causing the pain, which goes back to this. X-rays, big thing in chiropractic. How many X-rays? What X-rays? Great baseline, certainly in trauma X-ray. But X-rays, once again, are not necessarily positive over long-term use. Cortisone shots has its place. The problem is they're only very, very effective for like a bursitis. Great if you know exactly an acute injury occurs, but over a long duration of time, they're not going to be all that effective. And finally, my goodness, guess what? Pain opiate use. How unhelpful is that? Lancet blew that up, if you will. We all know that we had a pain opiate. We have a pain opiate epidemic. The president even talked about it. So 78% of people in the Palmer-Gallup poll said they're looking for alternatives, natural alternatives to pain. So let's go over 2 of them. Do we have anybody that was a shout out that I needed to grab? Or we're a little...
We have a Luvana Ramirez says hello.
Hello, Luvana.
And Al also says hello.
What's up, Al?
And then we have a question about
Sure.
fibromyalgia. Eric Williams What can we do against fibromyalgia?
Hey, fibromyalgia, it's not lower back pain. I don't want to go off on too much of a tangent. Fibromyalgia is a very interesting thing. Chiropractic is great. Chiropractic with nutrition works wonders for fibromyalgia. Fibromyalgia is something that you've got a lot of discomfort in all four quadrants, 1, 2, and 3, 4. You have fatigue. You have 11 out of 18 tender points. You press it and it hurts. It is a elevation of sensation in the central nervous system. So it's kind of elevated. And what we found works really great is chiropractic treatment, fixing the gut, and low-level laser for fibromyalgia. Get a lot of fibromyalgia patients. We bring down the inflammation from the inside out. We do some chiropractic with the functional medicine. Great outcomes. Eric, if you have any questions or somebody that you know, feel free to DM me and I'll tell you exactly what you need to do to help that person. Sounds good? Anybody else? Or we're ready to go. Let's do it. Here's your treatment. As I said earlier, exercise reduces reoccurrence by 50%. Number one thing you want to talk about in exercise is get moving. Let's move. We're made to move. Let's move it, not let's use it. Let's not abuse it. In addition to exercise, it's all about the core. No sit-ups. No sit-ups. No crunches. They damage your lower back. Do not do them. What you want to do is you want to do things like bracing, holding your core in a position where you get a 360-degree co-contraction so you're able to engage your own natural belt. Your musculature belt goes around, it's 360 degrees. Remember, your core right in here isn't supposed to move. It's supposed to hold you in place so you can move your arms and your legs. That's a critical element. No sit-ups, no crunches, planks, front planks, bird dogs. If anybody needs some exercises, I'm very happy. Just let me know. Joanne's right there. Say, I want some core exercises, and we will attach them or email them to you. Is it better to email? Is it easier for you to email it?
Email, probably.
Okay, so give me your email. If you want a list of some core exercises, I've got Chiro Up and Web Exercises. Both do a great job. I'm happy to send you some core exercises that you can do at home. And always look at my Mobility Monday, where we have a whole bunch of fitness and personal training young ladies who are always showing different core exercises. As a matter of fact, this Mobility Monday that was yesterday, we were doing what we call a gunslinger move for the core. It's good exercise. So anybody, give your email. Joanne will take care of that by tomorrow. In addition to the exercise and the core, I told you got to exercise because you also want to keep your weight down. So we're going to get into that at the end. Adjustment. Chiropractic adjustment has been shown to be extraordinarily effective for lower back pain. Don't be afraid. Seek out chiropractors. It's where we really, it's one thing that every chiropractor really can, hang their hat on. We're fabulous at spinal adjustments. Spinal manipulations is what we do every day. Yes, everybody knows I am a chiropractor. I still do chiropractic treatments. I get them myself. I need them with my issues. So an adjustment is a great way to start off and Lancet had talked about it as an excellent treatment alternative to lower back pain. Decompression, didn't put it up. Love traction and decompression. Fabulous thing. It opens up the spinal canals. By opening up the spinal canal, gets a little negative vacuum. Pressure comes in and it pulls the disc material in. Big thing. Traction opens up the spinal joints. By opening up and moving the joints, you get something called inhibition. Essentially, it enables the discs to get nutrition to heal. Soft tissue. Some of the soft tissue, you do soft tissue with your hands. Active release is one of the ones that I like a lot. In addition, good friend, big shout out to Todd and Jessica Real at Factor. So this is a soft tissue technique. This is an instrument-assisted soft tissue technique. It breaks up muscle adhesions. It breaks up fascial adhesions. It's great for lower back. You simply add an emollient and you rub it in the area. I've been using instruments for about 12 to 14 years, the best instrument-assisted technique out there. Todd does it, Dr. Tom Hyde, a mentor of mine. Also, they do Factor, so instrument-assisted. In addition, laser. Everybody knows, here we go. I'm a laser guy. What's up, guys at Arconia? How you doing? Here's my base station. Love my FDA-cleared laser. I'm currently involved In a study on laser, I love my FDA cleared laser. Laser in a nutshell sends photons through a natural beam of light at the right wavelength to help heal the body. ATP, oxygenation, neurotransmission. It allows for cellular communication, cellular regeneration. It allows for cells to heal. Treated patients this morning on the laser, and they got up and go, I'm 20, 30, 40% better just with the laser treatment, where I was getting no response through other treatments previously, pain meds, etc. So for me, I don't know, hands, laser, I put it all together. So I believe the laser is a great choice. So again, big shout out to Arconia. Thanks for making such a great laser. Looks like we have something else. I can see you moving. What do you got?
We have James Shanks, leg lifts.
James, how's the hair doing, James? But leg lifts, no. Negative. Leg lifts. So what happens is the leg lifts are engaging. Yeah, I can imagine what he just said. Hold on to that. I don't want to lose my thought. You're laughing. Leg lifts don't work because leg lifts engage your psoas, which are hip flexors. Your psoas, your hip flexors, cause pain to your lumbar spine and pressure. It causes anterior pelvic tilt. No leg lifts. Nothing moving if you want to get the core engaged. It's these planks. I wouldn't mind a rollout, a stir the pot. No leg lifts. You're not going to move your legs on your pelvis to enable your core muscles, your intrinsic and dynamic core muscles, to get stronger. What did I get as a feedback?
Travis says your hair looks marvelous.
Travis, I do appreciate that. Thank you very much. Are we good? Anybody else down? All right, good. Here we go. Tape. Performance Health, one of my favorite, TheraBand. I like the tapes. We do a lot of taping. Everything's based on the premise of kinesio tape. So we like to tape after treatments. You usually can keep the tape on for 2 to 3 days. The tape is great because the tape allows for what we call a proprioceptive field. Here's your skin. There's 500 nerve cells in your skin. So it sends a feed to your brain and your brain responds. Non-painful stimuli. I'll say that again. Non-painful stimuli gets a non-painful response from the brain. So I love the tape because it's like the finishing touch to my treatment. Nutritional protocols. Well, diet and supplements and nutritional protocols. So let me talk about diet. I just had a patient come in today, and it's very heartbreaking because it was very difficult to help her. And at the end of the day, we all chose this profession and we go to the doctor to get helped. And that's what drove me into the profession. So I noticed that she was a little heavy and she had a lot of lower back pain, and she wanted to eat something outside. And what was she eating? White bread, gluten, white bread, sugar, soda, processed meat, mayonnaise. It was just a horrible lunch for her. So she's already inflamed, her back hurts. So diet is a potentiator for inflammation. Food is information. Let's put good information in our body so it can process. We're going to have a really great dinner tonight at Boulay. We're going to feel really good. So understand that diet is a critical element. No gluten, no processed food, no sugar. Try and avoid your dairy. Decrease your amount of lectins. Diet is a critical element. Nutritional protocols. I broke it down in acute, subacute, and chronic. And then, of course, we've got wellness and prevention. So in acute stage for lower back pain, since we're talking about lower back pain or that acute phase, I like specific things like calcium and magnesium. Great for muscle spasms. You could get a little valerian root in there, also open up the spasms. Proteolytic enzymes like bromelain, trypsin and chymotrypsin. They're fabulous because they take the cellular debris away from specific injuries. And now with that calcium and magnesium, you're having a great option to work with muscle spasms. Subacute, specific herbs. I love a lot of herbs like xanthohumol and thea. These herbs are they're anti-inflammatory. Turmeric, which has a very bioavailable ingredient called curcumin, also anti-inflammatory. Boswellia, ginger, also great for the subacute stage. Glucosamine and chondroitin has really been shown to be very, very, very effective for cartilage and things of that nature. In addition, for something that's chronic, some of the chronic things I really like to use are omega-3 fatty acids. No surprise there. Omega-3 fatty acids have a very positive healing effect. They have some anti-inflammatory properties. And something that I find very unique that's fabulous, actually for all the forms of inflammation, is specialized pro-resolving mediators. They're a fractionated form of fish oil. We carry them in the office. Those SPMs are great for the resolution of inflammation and the balance between initiation and resolution of inflammation. Inflammation is healing, but when it goes too high or too long, tissues don't heal quite as well. And believe it or not, proteolytic enzymes, the good bacteria really help your gut. The bulk of your immune system, your immune cells are in your gut. So proteolytic enzymes are a great choice. That's just a few of the things that you could consider. For me, wellness and prevention is what I call my Super 5. My Super 5 is very simply multivitamin, multimineral, phytonutrients. I put that in a phyto multi, so I get all my nutrients. Phytonutrients are interesting in that it's kind of like eating like an organic kale. It's a little bitter. That bitterness is the phytonutrients. Those nutrients are bitter because they've been able to prevent insects from eating the plant. So what do insects like? Sweet things. They'll eat fruit. If it's something bitter, they'll go on. The more bitter some of these nutrients are, the stronger they are in phytonutrients. Phytonutrients enable communication, good health communication in the body. Omega-3s. We talked about that before. Critical element for overall cell health. Good for body composition. In addition to being good for body composition, they work very synergistically, symbiosis. With exercise, vitamin D should be called hormone D. 5,000 IUs, even though it's really warm. Joanne and I are working here. We don't get to go out between 10 and 3, so we don't get the sunlight that we need. So vitamin D is an outstanding overall health vitamin. It's great for the gut. It's great for musculoskeletal. Really puts the brakes on an inflammatory immune system. Probiotics, talked about it before. 70% of your immune cells are in your gut. Big thumbs up to that. And finally, I'm a big proponent of a phytonutrient drink because we need 9 to 13 fruits and vegetables. Phytonutrient drink like a Phytoganics or Dynamic Greens, shout out to Nutridyne, is a great choice because they have organic or almost all organic fruits and vegetables. You're getting 20 to 40. You get it all in one very tasty scoop. You mix it anywhere you want to do, whether you're on a ketogenic diet, the Mediterranean diet, the paleo diet. So that's an overview. What do we got? I can see you moving back and forth.
Is the good morning exercise beneficial for a lower back?
I like how you went good morning. So good morning exercise is that you hold. The key to a good morning is everything key to lower back. And we should have talked about movement. Movement is, we got some stuff going on. So the good morning is all about a hip hinge. You don't want to round your lower back. When you round your lower back, it's flexion in your lumbar spine. You get 28,000 flexions in your lumbar spine, and then you're going to damage your disc. You want to hold your position, a hip hinge. Good morning usually has a weight on your back. You can use a band, and you bend over at the hip hinge. So good mornings are great. But I'm going to give you a little takeaway there. And this one's for Joanne because she says, Dr. Rob, I don't want to just know how to do the exercise anymore. I want a tidbit. And your tidbit is, I don't like doing a lot of lower back exercises in the first 2 hours of the morning because if you don't flex in the first 2 hours of the morning, you're going to have a better chance of not injuring your lower back. I know we got some others.
So Stacy.
Hi, Stacy.
She would like to know if hanging down on a machine is for pain.
So I guess she means hanging like this. So hanging is great because that's gravitational attraction. I have no problem with that. I like that. It loosens up the joint. Let gravity do its job because gravity usually compresses us. Hanging is great. I don't even have a problem with the inversion table. My wife likes it. It works really well by inverting. So either one works for me.
Pierre.
Hello, Pierre.
How much vitamin D do you recommend daily? It's a two-part question.
Okay, hold on. Let me get that one. Okay. So, Pierre, typically blood tests will always tell you it's 2,000 to 5,000 IUs with K2.
Okay. What about for someone with an autoimmune disorder?
Or autoimmune disorder? And that's a great question. Autoimmune disorder, probably 5,000 to 10,000. Again, IUs with K2 per day. Always by a blood test.
Okay, that seems to be all. Thank you. Stacy says thank you.
You're more than welcome. Guys, remember every Tuesday, 2 o'clock, we're going to be doing Facebook Live. We're also going to be doing Proven Health Alternatives. I got some big name guests. We're probably going to start the first week in July. We're going to do it on Thursday. We're just debating if it's going to be Thursday at 12 or we're going to air, or Thursday at 3. But I have some big names for you guys that we're going to interview you. It's going to be my own webcast. So I have a great idea. In addition, if you didn't give me your email to get those exercises, you tell me, who would you want to hear from as an expert in a proven health alternative? Anybody in America. You tell me and we'll try and get them. That's it. We're good?
Up here, again, how much K2 with the vitamin D?
I'm going to answer that because I got to look that up. I can't remember every dosage offhand. I'm sorry. But I'll give you an answer to that.
Okay.
And we're good?
That's it.
Hey, guys, don't forget, like, click, share. We'll answer your questions if you have something afterwards. Every Tuesday at 2 o'clock. And don't forget, Thursday, starting in July, we're going to have our Proven Health Alternatives webcast. Dr. Rob, always yours in health.